So it looks like the clinic is about to close for the night, but it does look like I have one more exam here for today. Nurse's note here says it's for a fast annual checkup, that there appears to be no problems that they could find for the preliminary. And it does look like this is just for an annual test and checkup. Okay, let's get the nurse to send them on in. And do I have all my tools? I have my lenses, I have my lights. Perfect timing. Well, let's just see if we can wait and get them to just arrive by in time. Hello there, perfect timing. Welcome to Dream City Eye Clinic. I'm Dr. I. Pleasure to meet you. I'm the ophthalmologist here for this clinic, and I know I'm not your primary eye physician, but I will be taking care of you today if that's okay with you. Perfect. Again, pleasure to meet you, and what a beautiful night, I have to admit. Yes. So I do hear that you are here for just a very fast, very basic eye checkup. Is that correct? Yeah. And how much time do you have? Just a couple minutes, maybe 10 at maximum. Okay, well, we will speed this up to make sure that you get in and out. Can I quickly get your name? And how do you spell that? Is that with an I or an E? And last name? Beautiful name, by the way. Good. And birthday? And do you still have the same address? Is it just for insurance purposes? Are you still with the same insurance? Good. And since I've seen you last, or since we've seen you last, have you had any problems with your eyes? Perhaps a change in prescription? And do you wear contacts or glasses? Okay. So, got you all signed in here. The first thing I like to do is I'm going to ask you just to sit down at that chair in front of me and just relax, okay? This is going to be as quick as possible to make sure that you are having none of your time wasted. So, what I do first, I just like to get a bit up close and look at your eyes. Are you wearing any makeup right now, which could be blocking your eyes? Okay, and is this your natural eye color, or are you wearing colored contacts? Okay, so those are your natural eyes. Are beautiful, by the way. And do you have any light sensitivity or partial to light? Okay, do you spend a lot of time in front of a computer screen? Do you do a lot of work in front of a computer screen? Okay, are you on your phone constantly as well? Do you feel like your eyes get tired, or do you sometimes get headaches? Okay, I do see what's going on here. So what I'm going to do first is I'm going to shine a light into your eye, okay? So this is your left side and this is your right side, correct? Good. And I'm going to ask you just to simply follow the light for me. So if you could just look up for me. Good, and look all the way down. Good. Look over to your left and look over to your right. Okay. I'm going to ask you just follow up, but don't move your head or your neck, okay? Good. It's going to be a bit difficult, but just work with me. Good, follow the light. Good. Good, follow the light. Look up. Good, look down. Look over here. And look over here. Good. Now I'm going to do something with my hands here. I want you to follow this finger over here that's to your left, but don't get distracted by my hand that's over here, okay? Good. So just don't get distracted. Good. Good. Very good. Okay, now I'm going to quickly test your peripheral vision, okay? So you let me know when my hands are out of your peripheral vision by saying now. Okay, let's begin. Good. 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 And now let me know which hand gets out of your peripheral vision first, my left or my right. Okay? Good. 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 Perfect. Now I'm just going to quickly take a look into your eyes with these spectacles. I do have these pair of glasses here, and it's to check your pupils and your iris, okay? And what I'm going to ask you to do is I'm going to ask you, and what I'm going to ask you to do is I'm asking you to just sit still and just look directly into the lights here, okay? Make sure that they're turned on. Perfect. So I should have one that's properly bright. The other one's a little bit less bright. Can you look at the more bright light for me? Good. I'm just going to get a bit up close to your eye really carefully, and I'm going to use just a bit of a cotton rod. I'm going to take a quick look. Okay, perfect. Thank you so much. Now what I'm going to do is I'm going to add a couple of eye drops into your eyes to dilate your pupils, okay? And this is so that I can look into your eyes a bit deeper. And I'm going to ask you to look up. Look up for me. Good. I'm going to add 2 drops in each eye. There's 1, 2. And if you could blink, close your eye, head open. Close your eye, head open. Close your eye, head open. Good. Other eye, if you could look up for me. Look up. Good. 1, and 2. Good. And if you could close your eye open, close your eye open. Good. Get that into the eyes. Now what I'm going to take a look at just up close. Does look like that's working already. That's perfect. Do you feel your eyes are getting a bit more sensitive to light? Yeah. Let me turn a little bit of the light down over here. Is that any better? Perfect. So what I'm going to do is I'm just going to quickly grab my glasses and my light again. And I'm going to get my magnifying glass and look directly into your eyes. Can you look at the light for me? Good. Look at the light for me. So no problems with the pupil, no problems with the iris in the back of the eye. Looks good. Other side, no problems with the pupils, no problems with the iris. Looking at the back of the eye. Very good. Okay, can you follow the light again? Good. Keep following the light. Good, and above and below. Perfect. And I'm seeing no problems with the iris. That's perfect. Good to see. Now I'm going to give you a quick test. I'm going to blow a little bit of air into your eye, and this is to test the health of your eye, okay? So I'm going to put that next to your eye. You shouldn't feel it. I'm going to test in 3, 2, 1. Good. And 3, 2, 1. Good. The eyes properly function. Let's test the other side. 3, 2, 1. And 3, 2, 1. Okay. The eyes function perfectly, and they had the perfect function of movement when I did test that, which is exactly what I'm looking for here. Perfect. So we're going to begin with the lens 1-2 exam, and what I'm going to do is I'm going to put these lenses on you. These are glasses, and they hold lenses right in the center of them. I'm going to present you 2 different lenses at a time, and you let me know which lens is better, the first lens I show you or the second, and I'll show you exactly what I mean by that. So I'm going to put these on you if that's okay with you. Good. Setting that on there. Is that comfortable? Good. And we're going to first test with some tester lenses. I always use these. Now I'm going to ask you just what you see. I'm not going to ask you which one's better, which one's worse. I'm just going to ask you what you see. So we're going to test the first lens here, okay? And what do you see? Red. Perfect. This is a red lens. And do you see that the light has increased or decreased? Decreased in light. Perfect. So that is a red sensitivity light. I'm going to test you with our other one here. And what do you see? Nothing at all. Perfect. That's exactly what I was expecting. So what I'm going to do now is I'm going to give you a bit of a higher prescription, and I'm going to ask you which one's better, lens 1 or lens 2. You'll understand once I test you. So here's lens 1. Okay, you see it's a bit not your prescription. It could be a bit fuzzy. And here's lens 2. And which one's better, lens 1 or lens 2? Choose one. Which one's better, lens 1 or lens 2? Lens 2. Perfect. This is more your prescription. Try this again. This is lens 1. And this is lens 2. Are we getting better or worse with lens 1? Worse. What about lens 2? Better. And which looks better, lens 1 or lens 2? Good. Lens 2. Let's try again. Lens 1. Lens 2. Lens 1. Lens 2. Which one's better? Lens 2. Okay. And let's try this now. Lens 1 or lens 2? Lens 1 or lens 2. Okay, and lens 2 happens to be your current prescription, so we're going to write that down. Looks to be better. I'm going to take a quick look at your eyes, because your eyes are properly reacting, especially with the eye drops. Looks good. Okay, now we're going to test the convex sphere, and this is actually the different form of glasses that you typically wear. Glasses go convex and concave. We just tested the concavity, and now we're going to go to the convex test, okay? And so this will actually make the image a bit wider, or a bit more in focus in the front and more blurry in the back. A lot of people like these lenses. So this is lens 1, and here's lens 2. Which one's better? Lens 1 or lens 2? Lens 1 or lens 2? Okay, good. Lens 2. Just making sure that we rush this a little bit. Don't want you to be here forever. Just want to make sure your eyes are good. Lens 1 or lens 2? Lens 1 or lens 2? Lens 2. Good. Getting closer to your prescription now. Okay. Lens 1 or lens 2? Which one's better? Lens 1 or lens 2? And what does the visual look like right now? Does lens 2 look good to you? And what about lens 1? A bit more blurry. Okay, then let's get to your normal prescription. Here's lens 1. Here's lens 2. Which one do you like better? Lens 1 or lens 2? Do you prefer lens 1? Because a lot of people do, and that's because the background can be a bit more of a fuzzy effect, giving it kind of a cinematic look. So which would you like better, lens 1 or lens 2? Perfect. So let me write that down. So I do notice that you did have a partial to that and like that. I'm going to take a quick test of your eyes to make sure that nothing's happened since the last time we've seen you here. And especially because your eyes can't feel it right now due to the eye drops, I'm just going to take a quick test with a little bit of a Q-tip here. I'm going to send this into our lab afterwards, so if you could look up. Good. It's going to take a little sample of that. Good. I'm going to send that into our lab to make sure that everything's okay with your eyes. I'm just going to give a general look at you, and then let's just take your lenses off really carefully, okay? I don't want you to just be sitting there with these glasses on. Okay, do your eyes feel okay after testing that? Sometimes when we use lenses, your eyes can feel a bit, you know, just a bit of an imbalance. They're good for now. Okay, it looks like your eyes are doing good. I'm going to just carefully get your eyes tested and send that into a lab just in case something ever happens. But you come on in if you have any problems, okay? Just making sure that we also make it in the time span so that you're not here for 1,000 years. Good? Good. Thank you so much for coming on by and having your eyes tested. And have yourself a good night. We gotta close the clinic now, so please make haste. Thank you.